Good day, my name is Celine Sequeira, and today I will discuss about rotational thromboelastometry, or ROTEM. ROTEM is usually found in ICU, emergency and trauma unit, and in theater. Before we jump to the uses of ROTEM, I will be discussing of the common effects of trauma, such as blood loss, and the importance of its early management and treatment. Hemorrhage is associated with increased patient morbidity and mortality. These may be related to surgery, trauma, childbirth, coagulopathy, or combination of these. A quarter of severe trauma patients suffer from coagulopathy upon admission to the emergency department. Trauma-induced coagulopathy, or TIC, have an increased risk of transfusion requirement and higher risk of mortality. TIC is a variant of disseminated intravascular coagulation, also known as DIC. DIC occurs secondary to an underlying disease characterized by an absent localization of coagulation that leads to formation of small clots that may block microvasculature and depletion of clotting factors that leads to increased bleeding, leading to organ dysfunction. Guided measures such as laboratory tests, clinical judgment, point-of-care tests such as Thromboelastography, or TAG, and Thromboelastometry, or ROTEM, are utilized in transfusing appropriate blood components to the patient. Early management of blood loss that may lead to hemorrhagic shock decreases patient morbidity and mortality. Early treatment and intervention, such as coagulation management, prevent further impaired hemostasis, thromboembolic events, and reduction of inappropriate blood resuscitation. So, what is ROTEM? What does it do, and how does it work? Rotational thromboelastometry, or ROTEM, is a point-of-care hemostasis test used to diagnose coagulopathy and provides guided algorithm for appropriate hemostatic therapy. A blood sample from the patient is needed for ROTEM to analyze the patient's blood hemostatic function. ROTEM analyzes the blood's clot formation, clot propagation, and clot lysis. ROTEM also analyzes the number of platelet and fibrinogen reserve in the blood sample. TAG, the predecessor of ROTEM, was invented by Dr. Helmut Harder in Germany in the year 1948. It was used to study blood components, and this technology was used during Vietnam War. How does ROTEM work? Both TAG and ROTEM are an assay analyzer that mimics venous blood flow. Both analyzes the stages of clot formation and clot dissolution. TAG and ROTEM use whole blood sample placed in a cuvette. In ROTEM, the sensor pin is inserted in the cuvette and gently rotates, forming clots between the blood and the sensor pin. The clot's strength and elasticity are measured through a computer. The difference between ROTEM and TAG analyzer is that with TAG, the cuvette that holds the blood sample rotates instead of the sensor shaft. ROTEM provides 4 principal assays called XTEM, INTEM, FibTEM, and APTEM. With XTEM, extrinsic clotting cascade is tested for defects using the tissue factor. INTEM uses ellagic acid as an activator to detect intrinsic clotting cascade defects. FibTEM detects the amount of fibrinogen in a clot by using cytochalasin D as a platelet inhibitor. And lastly, APTEM tests hyperfibrinolysis using a protein inhibitor to stabilize the clot. ROTEM provides numerous benefits to the patients and clinicians when managing coagulopathy. It also provides opportunities to nurses to further develop their skills by using this technology, such as the use of ROTEM requires the clinicians to be trained and educated on operation and interpretation of algorithms for blood therapy. For nurses, this means advanced education about coagulopathy and its appropriate therapies. With training and education, the nurses will be able to interpret data and will be able to detect any abnormalities in the blood reading of the patient. With the ability to interpret data, the nurses will have the ability to identify the clinical problem and anticipate of the interventions needed to manage and treat the condition, which eventually leads to enhanced evidence-based practice. These additional skills will allow the nurses to have enhanced opportunity to collaborate with the multidisciplinary team to achieve the best patient outcome. And now I will discuss the challenges the ROTEM is facing in the clinical practice. ROTEM must be used for more than 326 days per year for it to be cost-effective. ROTEM also requires regular calibration, which is deemed costly and its service not easily available. Training is required to operate this machine, making it operator dependent. Errors may still occur due to a lot of factors such as calibration, expired activators, and such. Intersampling inconsistency may also occur, which can contribute to error, and up to this day, there are still not enough randomized controlled trials to prove ROTEM's accuracy and dependability. Despite the challenges of the usage of ROTEM, the analyzer is widely used in ICU, theater, and emergency department, as it has the ability to provide guided algorithm for transfusion therapies. ROTEM can rapidly detect coagulation changes, making it time efficient, requiring only 5 to 10 minutes of waiting time for the results. It also uses whole blood to analyze hemostasis. It has 4 different simultaneously working assays. It detects hyperfibrinolysis. It is portable, which means it can be used at any stages of care. And it contributes to reduction of hospital cost due to the prevention of inappropriate blood transfusions. To summarize, ROTEM is a point-of-care test that diagnoses coagulopathy using whole blood sample. It is commonly seen in ICU, theaters, and emergency department. Nurses acquires additional nursing skills from using ROTEM, as it requires additional training and education for its operation. This helps the nurses to anticipate interventions and managements for improved patient outcomes. Although ROTEM is still facing some challenges, it provides plenty of benefits such as time efficiency in diagnosis and guided algorithm for appropriate blood component therapy, which overall reduces hospital cost and leads to better patient outcomes. And these conclude my presentation of rotational thromboelastometry, or ROTEM. Thank you.